When people go to the doctor, they get their vital signs checked, like temperature and pulse, to help determine whether they are sick. But what if a wearable device could track and record those signs 24/7? That's the idea behind a nationwide study, says UCSD bioengineer Benjamin Smar.
This is it. It's this little ring, goes on my finger, and it's using LEDs.
Researchers across the country are studying data from this ring made by a Finnish company called Aura. It can measure biological factors like heart rate, respiration rate, and temperature, which Smar says is exciting.
A lot of the systems in your body as they change. So you think about when you eat or your hormones having pulses through the day, that kind of thing turns out to affect your temperature. And so when we have continuous temperature, instead of just knowing I'm somewhere near 98 or I have a fever, you can actually say, is that structure a nice stable lapping waves of a healthy body, or is it starting to get roiled up and it looks like a storm is coming?
Participants volunteer to wear the ring and record their symptoms. Already, it has been distributed to thousands of healthcare workers with hopes that it will help protect them as they treat patients with coronavirus. Marco Lee, a neurosurgeon at the Santa Clara Valley Medical Center near San Jose, is participating along with some of his colleagues.
A lot of the symptoms in COVID-19 has been reported to be very mild. And you may have had a COVID-19 infection without really knowing. Sometimes we work long hours. Wearing the Oura ring could actually spot some temperatures that you yourself might not be noticing. And that kind of hopefully would prompt the person to maybe take their symptoms more seriously.
But Lee says it's still too early to tell whether the ring works.
At the end of the day, we don't know. We don't know how useful this ring is going to be. And we don't know how useful it is to develop an algorithm to spot the symptoms of COVID-19. So that's why there's a study. And I hope that, we're going to get a lot of participants.
Researchers say they're hoping to collect enough data to know if the ring can become a safety and disease prevention tool for workers on the front lines fighting to keep people alive. Shalina Chatlani, KPBS News.